Hello there. One thing I didn't come across while practicing in Nigeria is whiteboards in patients' room. So let's talk about it. So these whiteboards are like a central location where communication about the patient can take place. And this communication can be between the healthcare professionals, uh, and the patient, healthcare professionals and the patient's family. So, pertinent information about the patient is written on that board so that everybody can be on the same page about what is going on with the patients. So, some of the major things that are on that board, before I do that, I would like to mention that there are many types. Depending on the facility or hospital or setting, the board is adapted to suit what happens in that facility. And then there are also different types. There are some fancy ones, there are even digital ones. But I'm just going to focus on the main things that are on that board and the main function of the board. So the main information on the board, of course, the pertinent information about the patient, the patient's name, specifically how the patient wants to be addressed. So some people may have a legal name, but they have another name they want you to address them with. So the patient's name, the patient's maybe age, and the patient's other major information about the patient. Let me just put it that way. Then the healthcare professionals, the team of people taking care of that patient, the nurse, the doctor, the physical therapist, the occupational therapist, the nurse assistant, the dietitian or nutritionist. So their names, if there's a social worker, their names will also be on there. It doesn't have to be their full names, maybe just their first name. Then another thing that will be on there is a condensed version of the plan of care or goal of treatment. It should be on that board. Also, the anticipated discharge date, the day that the patient may be discharged, should be there. And then also the patient's ability to, if the functional status of the patient, let me put it that way, how much can the patient do for himself by way of ADLs? Can they dress themselves? Can they brush their teeth? All those kind of things. How does the patient transfer should be on that board. The patient's mobility, can the patient ambulate? If he can ambulate, does he need a wheelchair? Does he need a cane? Does he need a walker? All those kind of things. Is a patient on fluid restrictions? If he is, it should be noted that all these things is concise. You don't have to go into details. Just put the major information there. So basically, those are the things that should be on that board so that anybody who comes in, be it a doctor, a nurse, a respiratory therapist, whoever, as soon as they lay eyes on that board, they know what is going on with the patient. The patient family comes in and lay eyes on the board, they know what is going on. Likewise, the patient themselves, they know what to anticipate, they know what what is coming. So that is it. Now, the advantages of this whiteboard is that, of course, obviously, it improves communication. And then with improvement of communication, teamwork is better. And then patient satisfaction is better. That's another advantage. Now, what are the implications for nurses? Nurses, I know everything is nurses that have to do it. Nurses are responsible for updating the board. So at the beginning of each shift, when you go in there, you update the board. Of course, it won't be the same nurse. It will not be the same nurse assistant. So all those things should be changed. And then if there is any change in the plan of care, it should also be changed. You find out the patient's pain level, put that on the board, put the time that the next pain medication is due so that the patient will know, what to expect. Then I think that's pretty much it for the boards. And another thing is that it helps in tracking the patient's schedule. Maybe if the patient has to go for an appointment, or the patient has to do physical therapy or occupational therapy at certain times of the day, all that is put in there so that the patient will know what to expect. Thanks for listening. Make sure to like, share, subscribe, and follow for more.